and we ended up having a surgical termination in the end. Before I got pregnant with my first, I didn't even know hyperemesis existed. I can't carry on with this pregnancy if I don't have help. I don't want to die. It was really hard. Unless you've been through something like hyperemesis, being sick 30, 40 times a day, I'm so scared I'm going to die. I was just bringing up blood. Nobody knew what I'd been through. Nobody knew what happened. I will do whatever it takes to have my baby, even if it kills me.
This podcast contains discussion of severe pregnancy complications such as hyperemesis gravidarum, as well as topics surrounding pregnancy termination. Some imagery may be distressing to some viewers. Welcome to the Silent Struggle podcast with me, Michelle Chan. Today's episode, we'll be talking about hyperemesis gravidarum. Hyperemesis gravidarum is a serious pregnancy condition with intense nausea and vomiting. It causes weight loss, dehydration, and poor nutrition. Unlike regular morning sickness, hyperemesis can last the whole pregnancy. Today, I'm joined by Callie. Her condition became so unbearable that she made the heartbreaking decision to terminate her pregnancy. Her story highlights the serious challenges of hyperemesis gravidarum and the urgent need for more awareness and support. So let's begin. Before we start, I want to thank everyone for listening to this podcast. It means so much to me. So I've got one small favor to ask. Can you please hit the subscribe button? I don't have a production team, so it's only me working tirelessly behind all this. So this would help me to bring more episodes of Silent Struggles to you. So if you could help me, help this podcast by hitting the subscribe button, that would mean the world to me. So let's get started. So welcome, Callie. Thank you so much for being here. Can you tell me a little bit more about yourself? Take us back from the beginning when you became pregnant and you noticed something was wrong.
So I fell pregnant really young. I was actually only 17 when I fell pregnant with my first. So obviously weren't planned. I didn't really know much about pregnancy. I kind of knew that morning sickness was a thing. And at the time, I remember a sense of when I first felt that morning sickness, in a sense, it was kind of, I felt proud. In my mind, it was like, it's meant to happen when you're pregnant. It's what happens. I really felt like I was pregnant. But that very quickly kind of disappeared when it became sort of 2 days in, it was continuous. And I became like bedbound. I couldn't get out of bed. I wouldn't leave the house because I was just so poorly all the time. I was pretty much only eating ice lollies. I was trying to stay hydrated on ice lollies. I couldn't manage foods. I couldn't really keep any water down or anything like that. But because I was so young, I didn't know there was necessarily anything wrong. My partner's mum, she never experienced morning sickness. My mum never experienced morning sickness. So they didn't really have anything to gauge it, kind of how bad I was. And I kind of remember my partner and my partner's mum saying to me, this is starting to get bad, you need to go to hospital. And I just kept putting it off because I was so young. I didn't want to walk into the hospital and say, I'm pregnant and I'm being sick, because I thought they would just laugh at me and turn me out the door. Like, I didn't think they would take me seriously. But the first time round, I got to about a week. I'd been being sick every day for a week straight, 20, 30 times a day, every half an hour for a week straight. It got really quite bad. And I ended up going to A&E in the end, went to A&E, and as soon as I got in there, they asked me to do a sample. I went to the bathroom. While I was in the bathroom, I was already being called through. I got called through. They just started poking about, prodding me, all this, that, and the other, and I had no idea what was going on. They put a cannula in my arm. They put some anti-sickness through the cannula, and then I just remember falling asleep. For the first time in weeks, I could sleep uninterrupted without waking up to be sick. And then about a couple of hours later, I woke up. I was being moved onto a ward, and a gynecologist explained to me that I had hyperemesis. He explained to me what hyperemesis was in terms of you're sick a lot, but he didn't explain to me that you've had a hospital admission and the chances are you're going to be back here again. He didn't explain that to me. I was just kind of told that your body can't handle the hormones. You've been sick a lot. But I was under the impression that the hospital had fixed me up. I'd stayed overnight. They gave me a lot of fluids through my cannula. They gave me anti-sickness meds through my cannula. and I got sent home with anti-sickness tablets. So I got sent home with cyclizine, and I thought, great, I'm fixed, brilliant. I can go home. That's it. It's over. I don't have to worry about it again. But then it was about 2, 3 days after it started again. And it went on for a couple of days, and my partner was like, "This isn't right. You need to go back." So I was devastated, to say the least, because I really thought I was out of the woods with that. But yeah, sort of after that point on, it just went on and on with hospital admissions, A&E trips. The early pregnancy unit wouldn't see me. My midwives wouldn't see me. The only way I could get access to medical care was going through A&E, which obviously A&E is very busy. The NHS is super like underfunded and everything like that. So there's such a long wait. So I was waiting anywhere from 2 hours to 6 hours every time I was going to be seen, which is really frustrating, because if the GP would have seen me, I could have been in and out of a GP in 10 minutes and sorted. But the GP refused to see me. My midwives refused to see me. They all refused to see me. It was basically, you've got to go to A&E. So that became an ongoing thing. And it was also, we were coming out of COVID. So I had to go on my own every time. And I was only 17. So sometimes I was in pediatrics. Sometimes I was in normal A&E, like the normal ward, the main ward. I was kind of being pushed pillar to post. They didn't really know what to do with me or where to put me. And I pretty much did it all on my own. My partner weren't allowed with me because of COVID rules. I wasn't allowed anybody there on the ward with me. I weren't allowed any friends, partners. No one was allowed with me, pretty much. So yeah, that was hard. And so with my first pregnancy, I had it all the way through until the end. I had it all the way through. I ended up having an emergency C-section. I had it all the way through until she came out. And then the moment she came out, the moment the placenta came out, I was better. It was, for me, I know for a lot of women, it's not, but for me, it was instant. That feeling of relief was instant. But it went on the whole way through. I found that for me, anti-sickness injections worked. So like into the muscle anti-sickness injections, they would kind of help keep it at bay for maybe a week, just over a week. So sometimes I'd ring up my GP. Sometimes the GP would allow me to go and get these injections to help keep it at bay. Sometimes they wouldn't. Sometimes they'd say, obviously, they didn't have the stuff for it. They didn't have the spaces for it to get me in or anything like that. So I'd have to then go to A&E. Every time I went to A&E, I'd have to stay overnight. So towards the end, I kind of put it off a lot because I hated it. I hated going. I hated staying. So I put it off a lot. I was very dehydrated. I lost a lot of weight. By the time I was full term with my daughter, by the time I was 37 weeks, I weighed less than what I did before I got pregnant. I'd lost about 15 kilos. I'd lost a lot of weight. And every time I went to the doctors, every time I went to the A&E, every time I went to health professionals, it was always the same. It got to about 12 weeks. They were sort of telling me at 12 weeks it'll stop, at 12 weeks it'll slow down. I got to 12 weeks and it didn't stop. At 12 weeks it was, you'll get to 16 weeks and it'll ease up, it'll slow down. I got to 16 weeks and it didn't stop. 16 weeks then turned to 20 weeks. And then by the time I got to sort of about 20 weeks, 30 weeks, all I ever got was, it's really strange that you're still being sick this late on in your pregnancy. And at the time I kind of thought, yeah, I know, but help me, please, somebody just help me, like somebody do something. And yeah, I just remember feeling really unwell throughout all of the summer. It's really silly, but now when it gets to that same time of year again, I panic. I feel like I should be in hospital, or I feel like I should be, because I'm so used to just that whole summer was just, I was bedbound the whole time. I weren't really a great sort of partner. I weren't really a great sort of person to be around, because I couldn't, my friends kind of stopped seeing me because I couldn't go out and do things with them because I was so poorly all the time. And a lot of people didn't really understand. A lot of people didn't really get it. I mean, at the time I was so young and everything was so new to me. I didn't really get it either. Like, I kind of kept listening to what the hospital was telling me, to what the doctors were telling me. And, you know, I got the whole, have you tried ginger biscuits? Have you tried eating little and often? Maybe try just little nibbles here and there. And, no matter how much I said to them, nothing works. None of that works. I try and take sips of water and it comes straight back up. None of this works for me. But nobody ever really listened. It was always the same thing. Go home, make sure you stay hydrated. They were telling me all the things I already knew, basically. But yeah, my first pregnancy with my first daughter was definitely the worst. I was so poorly. I was so unwell. But I think because it was my first pregnancy and I kept getting told by the doctors and the healthcare professionals that it'll ease up, it'll stop, it'll come to an end, I did have a little bit of hope. There was a little bit of hope keeping me going. I didn't know what to expect. I didn't know what was going to come. I didn't know what was going to happen. But then we decided a couple of years after about a year and a half after our little girl was born, that we wanted to try again. We wanted another baby. So we did. We tried for another baby. I fell pregnant. We were over the moon, but also as soon as we found out I was pregnant, that panic set in. I'm going to get upset, and I really don't want to get upset. But yeah, so we found out I was pregnant, and it weren't long and the sickness started. And I had done a bunch of planning before getting pregnant. I had tried to get the GP to agree to medication with me. It was in my first pregnancy. The best anti-sickness medication for me that worked for me was ondansetron. I didn't get prescribed that in my first pregnancy until I was 36 weeks pregnant. It's classed as a second line drug. They like to go through all the first line medications first. So I didn't get prescribed it until I was 36 weeks pregnant. I knew the second time round, I need ondansetron. I need this drug. That's what I need. Nothing else works. Cyclizine doesn't work. All the other first line medications, I tried about 5 or 6 different medications. None of it worked. I knew I needed ondansetron, but I just couldn't get any of the healthcare professionals to agree to give it to me. None of them wanted to give it to me. So before getting pregnant the second time round, I did a bunch of planning. I spoke to pregnancy sickness support. They were really good. They were really helpful, but they can only kind of do so much. So I ended up pregnant, and it was basically the same thing with my first. The GP wouldn't prescribe me anything. The GP was only comfortable to give me cyclizine. He didn't want to give me the second line drug of ondansetron. He said to me that basically he didn't want to give it to me because that isn't his area. He doesn't know a lot about it. If anything goes wrong, it's going to fall back on him and he'll be in trouble for it. So he didn't want to prescribe it to me. And the hospitals, I ended up sort of again in A&E, and the hospitals and the gynecologists, again, they didn't want to give it to me. I was given the same, at 12 weeks, it'll stop, it'll slow down, try and eat little and often. And this time round, I knew that wasn't the case. I knew that weren't going to happen. And I remember sitting with my partner. I rang around a lot of hospitals in my area. I tried to ring early pregnancy units, maternity units. I rang so many places, and so many people told me that they couldn't give me the medication I needed. And I just remember sitting on the sofa with my partner and just sobbing my eyes out, saying, why won't nobody help me? Because all I needed was help. And I don't want to get upset, but I ended up getting to 8 weeks, and I had my midwife appointment. And I thought, this is it. The midwife, she should have my back. She will help me. She will give me what I need, And I couldn't have got a worse midwife if they tried. She was awful. She basically told me that being pregnant, you should expect to stay in hospital, and you should expect to be poorly, and this, that, and the other kind of thing, and that it's normal to be poorly, and it's normal to spend time in hospital. And I kind of said that, I've got a toddler, I've got a little girl. I can't spend time away from her. I can't be away from her. And she basically said that on their end, as midwives, there's nothing that they can do. They can't help. They can't prescribe me anything. They can't do anything. She didn't really fill me with much confidence. And I kind of went into that appointment basically saying to the midwife, I'm in this situation. This is my second pregnancy with hyperemesis. And if I don't get help this time round, I don't know if I can carry on. kind of expecting her to be like, whoa, don't be silly, we're going to help you, like we're going to get this under control, we're going to help you. But that weren't really the case. And then I had a lot of conversations with my partner and my family, and we went to speak to some people near where we live. I can't remember the name of the organisation now, but they basically talk to people that are in difficult positions like that don't know what decision they want to make. And we both spoke to different people separately, and we kind of came back together and said that, you know, we can't sorry we both kind of came back together and said that we can't carry on. We can't, it wouldn't have worked with our little girl, and my partner in the job that he's in, the hours he does and stuff like that. We both agreed without help, without medication, we couldn't do it. So I was about 12 weeks. I was further along than what I thought, so I couldn't have a medical termination with the tablets. And my hospital turned me away. They didn't help. They said, sorry, we can't give you the medical termination. We won't do a surgical one here. You're going to have to go and sort it out yourself. So I did. We went away. We researched some things. We researched some places. We ended up having to travel about 3-4 hours away to go to a BPAS clinic that would help. And we ended up having a surgical termination in the end. And it was really hard. It was really hard. I remember after we made that decision, I had to go back to A&E a couple of times because I needed the fluids and stuff like that, and I was poorly. And I remember saying to some of the gynecologists and stuff, even before we had kind of fully made that decision, like solidly, I kind of remember saying to them, like, look, I can't carry on with this pregnancy if I don't have help. I can't mentally, I can't do it physically, I can't do it. And I just remember kind of being told, if now's not the right time for you, now's not the right time for you. It weren't a case of, that's a last resort, we're going to do everything we can to help you. It was basically just, if you can't cope, you can't cope. And then in the end, I did end up getting on Danzatron, but it was only when we had made the decision to not carry on with the pregnancy, and I went to A&E and I spoke to a gynecologist and I explained the situation, and I said, I'm not carrying on this pregnancy. I need something to get me through the next couple of weeks. I can't carry on being this poorly the next couple of weeks. And then he agreed to prescribe me on Danzatron, kind of on the basis that I weren't carrying on with the pregnancy, which was quite like bittersweet in a sense that, you know, I was so relieved that I had finally got what I needed, but kind of like, at what cost? At what cost did I need to go through to get to this point? And yeah, it was really hard. It was really, really hard. And I just remember at the time saying to my partner that if I can't do it now, I don't know if I'm ever going to be able to do it. I don't know if I'm ever going to be able to do this with the hyperemesis, to have another pregnancy, have another baby. And I kind of really felt at the time that that's it. I can't ever have any more children. I can't do this ever again. And sorry, I really kind of felt like I was letting myself down, like I was letting my partner down, like I was letting my little girl down. It was really hard to kind of wrap my head around, not only not being able to continue that pregnancy, but also in the future, will I ever be able to do it ever again? Will I ever be able to have any more children? It was really hard. And that took quite a little while to kind of come back from. That took a while to kind of, we took a little while to decide that we got about a year or so down the line, and I was having a really hard time. Um, Whenever anyone in the family announced that they were pregnant, or anyone announced that they sort of in conversation or were trying for a baby or anything like that, really hit me hard. I really struggled. I remember we were at a family gathering, and out of nowhere, we were all grouped together for a family photo, and out of nowhere, it was, I'm pregnant. And it took every ounce of strength inside me to clap and cheer and be just as happy as everybody else was in that room. But then about half an hour later, I had to step outside, and I just broke down, just sobbing. And I haven't really spoken about this with anyone really, because it seems so selfish and it makes me feel so silly. But I just remember just absolutely sobbing my heart out, and my partner kind of coming out and saying like, we'll go home now, we'll leave. And because nobody knew what I'd been through, nobody knew what happened. And I don't want to inflict my pain onto other people when it's a happy time for people. It's a good time for people. And that was really hard. That was kind of every time, even celebrities in the media, saying that they were pregnant, announcing pregnancies. It was hard. It was hard to kind of it was hard to be happy for other people. And I think as well, because I had made the decision to not continue with the pregnancy, it made me feel even worse for feeling how I felt. It made me feel even more guilty for feeling how I felt. And I think that's kind of why I didn't tell anybody, kind of why I didn't tell anybody what was going on, especially because the people around me didn't really understand hyperemesis. I mean, you can never really understand it until you go through it. And I thought, people won't understand why I made my decision. People won't, people will judge me. People will blame me. People won't understand or have empathy for why I feel the way I do, when it was my decision ultimately at the end of the day. And that was really hard. That was really kind of hard to get my head around, and kind of suppress, in a sense, to carry on and be normal around everybody else because nobody knew. But then about a year later, we decided, we had a few conversations, and I kind of said like, I couldn't carry on the rest of my life feeling how I felt. I couldn't carry on. And in that sense, I felt so lucky that I did have that decision to say like, I will do this, whatever it takes, however poorly I get, whatever I need to do, I will do this. I can't go the rest of my life feeling so guilty and feeling so, always thinking about the what ifs, always thinking about what could have been. I couldn't go the rest of my life like that. And I said to my partner, because I think the mistake that I made, which isn't really a mistake on my part, more I would say kind of like on the healthcare professionals and stuff that I had. But when I got pregnant the second time, my mind was very much, I'm going to tackle this head on. I'm going to do it, and I'm going to be able to carry on and live a normal life. I'm going to have a good pregnancy this time. I'm going to have a really good time. I'm going to get the medication I need. I'm going to do it. I'm going to smash it, which I kind of very quickly realized, especially when we spoke about getting pregnant again, that I'm just going to have to accept I'm going to be in hospital. I'm just going to have to accept I'm going to be poorly. I'm going to be in bed. I'm going to lose weight. And I kind of had to make sure that that was okay for my partner too, because my partner had a lot to take on. He'd have to look after our toddler. He'd have to look after me. He'd have to look after the house, all while kind of being on his own, because I couldn't be with him. I couldn't spend time with him. We couldn't go out anywhere or anything like that. I was a rubbish partner in that time, and I was pregnant. I couldn't be me. I wasn't me. I wasn't the person that he kind of knew. So I had to make sure that was enough, that was okay for him to take on as well, because I think part of me kind of felt, is he going to resent me for this? Is he going to is he going to fall out of love with me? Is he going to kind of wake up one morning and think, actually, this is too much for me to cope with? I'm doing everything in this house. I'm doing everything for the kids. I'm doing everything for myself. And he weren't getting anything back from it. Like I say, we weren't going out together. We weren't going out as a family. I couldn't do any of that stuff. And yeah, I was kind of worried about the effect that it would have, not just on me, but on my whole family, on my family as a whole. When I got pregnant for the second time, something that swayed my decision to not carry on was my little girl was spending so much time at my dad's. I was so poorly. I was staying in hospital. She was spending so much time at my dad's. And I was so worried because she was so young. I was so worried that I would walk into my dad's house to pick her up one day and she'd just look at me and kind of go, no, I'm staying here. Like, she wouldn't want to come home with me because she never saw me. And I was really worried about that, kind of going through it again. I not only did I want to make sure I was there enough for my partner and stuff, but I really wanted to be able to carry on being the mummy that I was to my little girl. I didn't want her to lose out on anything. I didn't want her to miss out. I didn't want her to be spending so much time with other people that she would forget me. But we decided to do it. We decided that, we had enough help from family that we could do it. And I was at this point very well educated on hyperemesis and what I needed. And the first time round, being 17, the first time I was pregnant, you go to the hospital and you listen to what the doctor or the gynecologist is saying, and you just believe it. You just take it at face value because they're the professional. They know what they're talking about. What do I know? A 17-year-old who's pregnant for the first time, what do I know? They know what they're talking about. But this time round, I was very much I wasn't going to kind of take no for an answer. I think I was very much I know what I need. I know how this goes. I've done this before. I know it's not going to raise up at 12 weeks. I know it's not going to raise up at 16 weeks. Don't bother giving me that whole story. But we did. We got pregnant again, and again it was a very bittersweet moment to be over the moon that we were going to have another baby, but also kind of like oh great, what's to come kind of moment. Like, oh, we've got to prepare now. And it was about a week. This time around in my pregnancy, knowing that it will most likely be my last pregnancy, my last baby, I tried to document absolutely everything I could, pictures of when I was in hospital with dates on them and how long I was there for, whether I was admitted, what medication I was given. I tried to document everything. I found out I was pregnant, and it was about a week after I found out I was then in hospital. So it didn't take long. It didn't take long between finding out I was pregnant and ended up in hospital. And then I just had all the weights again in A&E, and I had all the cannulas and injections and being prodded and poked left, right and centre, and blood's being taken and all this, that and the other. And it was physically exhausting, but I think it was quite mentally exhausting as well, because I think I always had in the back of my mind, what if I can't do this again? What if? And the person I am now, I don't look back on myself and think that I was a failure by any means, but at the time I very much did. And I kind of just kept thinking to myself, what if I fail at this again? What if I'm a failure again? And I kept thinking to myself, I'm a woman, I'm supposed to carry children, and I'm very blessed with the fact that I can. But in my mind, I just always felt like it was so unfair that I couldn't do it properly. Why couldn't I do it right? Why couldn't I do it the way I'm supposed to do it? Why did my body have to react the way it had? Why can't I really thought at the time that it was me, like I was the problem, like it was something wrong with me and my body. And that kind of carried on with my pregnancy with my youngest. The whole kind of way through was just, it's me. I'm the problem. If I can't carry on this time again, that's on me. That's my fault. When really I feel now I should have been angry at the people that failed me. I should have been angry at the people that didn't give me the medication I needed, didn't give me the help I needed, didn't give me the support I needed.
You're a really strong, brave, and incredible woman going through every single thing that you've just been through with your first and your second. You're not a failure. There's so many people going through the exactly same as you. When I was pregnant, I feel the same, but mine was like just the first trimester, but I feel the same as you. So you're not alone, and you did an amazing job. So don't feel like it's you. It's
Yeah,
the condition, and it's the people who's supposed to help you that didn't.
yeah, no, definitely. I think now that that little bit older and I can look back on it, I definitely now blame the doctors that didn't help, the gynecologists that didn't help, the gynecologists that didn't even listen to me half of the time. Um, but I remember, and I still do now, and I think this makes me feel like a really bad person. But when I see people announce that they're pregnant, or I see gender reveals, or I see just pregnant people being happy, I always feel this sense of, and this makes me sound like such a bad person, but I always feel this sense of almost jealousy, in a sense that why couldn't that be me? I never got to experience a happy pregnancy. Even when I got pregnant with my youngest, my family weren't over the moon. My family weren't the first thing that they said to me. It wasn't congratulations. It was, how are you going to cope? I never had that spark of, yeah, pregnancy. Like, I've never had that joy come with it. And I think that's kind of hard. I think that's hard to see other people enjoying their pregnancies, knowing that I couldn't do that. I couldn't have that joy. I couldn't have that um kind of happy moment with everybody around me, because everybody was just so worried. And I think that was kind of hard. I think that was hard to kind of like, I think that kind of made it worse, in the sense that I felt like it was my fault, because I felt like the disappointment people had, they had it with me. I felt like people were kind of saying, what are you doing? Why are you doing this again? Why are you going through another pregnancy? It's kind of the vibe I got from people, and like my family and friends. And I know they only kind of said it out of care, I suppose. They were worried, but yeah, that was definitely hard. And I think it kind of further put in like that doubt in my mind of, what if I can't cope? People would ask me, how are you going to cope with this? And I would say, oh, I've got this under control, I've got that under control. But in the back of my mind, I'd be thinking, no, you're right, how am I going to cope? I don't know. I haven't got a clue. I don't know how I'm going to cope. I feel really bad for saying this, because I'm very much a person that believes that everybody affects different people differently, and everybody has a right to complain about whatever is affecting them.
Mhm.
But it's really hard to hear people that are pregnant complain about, I don't know, having a little bit of nausea or a little bit of morning sickness that has then kind of worn off. They've had it once or twice and it's worn off after that, and that was all they had. Or
Mm.
complaining about a little bit of a bad back and things like that. And I know that I can't judge how bad these things have affected other people, but I
Mhm.
think I always kind of feel, or people that have been up to the hospital, they've had to stay in hospital overnight for some reason, and they've gone home and everything's fine, and it's, oh, I had to stay in hospital, I hate being in hospital. And people do, of course. And I always kind of feel, I had to stay there pretty much my whole pregnancy. How do you think I felt? And I think it makes me feel bad for feeling that way, because I don't, I think everybody has a right to complain about whatever they wish to complain about, ultimately. But I think part of the reason I feel that way is because lack of awareness. There's so much like lack of awareness around
Mm.
hyperemesis, and
Definitely.
how much it affects people. And it's not just a little bit of morning sickness. It is literally being in hospital all the time, or being bedbound, or being sick all day, every day. I think there's so much lack of awareness around it. I think that's where I kind of feel there's almost a misjustice of, hold on, nobody's recognized how bad I had it. I just had to suck it up and get on with it.
Can you explain to me how many times roughly have you been in the hospital admitted, and how many times do you throw up a day or a week, so people are aware of how
Yeah,
extreme it is?
definitely. So in my first pregnancy, I was admitted to hospital every week. Pretty much every week without fail, I was in hospital. Every week without fail, I was in A&E. If I was lucky, I would get discharged the same day. I wouldn't have to go to the ward. But 9 times out of 10, they'd put me up to the ward to obviously be under monitor of midwives and gynecologists and stuff. And I'd stay a night or two, and that was every week in my first pregnancy. In my first pregnancy, I could go a few days without being sick, but for me, it was very much, as soon as I started being sick, I knew that I wouldn't be able to stop without medical intervention. If I woke up in the morning and I was sick, it would never, towards the end, there was no point in waiting. There was no point in kind of, well, let's see how I go. Let's try having a bit of food. Because it wouldn't go away on its own. I would have to go to hospital. I was being sick every half an hour to an hour. I was easily being sick 30, 40 times a day. It was so bad. It kind of got to a point where, because I wasn't managing to eat anything, my body, this sounds very gross, but my body had kind of got past the point of bringing up bile. I was just bringing up blood from my throat, where my throat was so, I had torn blood vessels. My throat was so sore and so ripped apart from gagging. I was bringing up blood, and literally anything that I had in my stomach was coming up. The point I was in A&E once, whatever, this is very gross, but whatever I was bringing up, it had kind of gone past the, like yellow bile. It was dark, black, almost like coffee grounds, which is obviously cause for concern. And I was in A&E, and a paramedic walked past, and he came in to check on me, and he saw my sick bowl sitting on the side, and he went, "What have you been eating to make it look like that?" And I said, "Nothing. I haven't eaten for 3 days." Like, I don't eat. I haven't eaten. And he was shocked at what he was looking at and what I'd brought up, considering I hadn't eaten anything. I could go a week without eating, yet my body would still somehow find something to bring up. There was still something left there to be brought up, which was rough. And the physical side is, obviously, it's awful being sick so many times a day, but it also got to the point for me that I was in hospital so much, I was so dehydrated, and I was having so many cannulas and blood tests. They got to the point all of my veins were bruised and burst, and they couldn't find, they tried going through here, they tried going my arms, they tried my hands, they tried everywhere. It got to the point where all of my veins were used up, all of my veins were bruised and burst, and they had nowhere else to go. It got really bad. So, like, there's like that kind of side of things as well. So it's like, you go to the hospital for your medication, for the fluids that you need, but it's so painful. It's so painful. And it's, I don't mind needles. I don't mind. I've never really been bothered about blood tests. I've never been bothered about stuff like that. Like, I don't mind them. But kind of now I'm at a point where if I have to go for a blood test, even the anti-sickness injections I used to have, because they go into the muscle, they separate the muscle as they go in, and they're so painful. They're so painful. So now, even when I go for like a flu jab or something like that, like a vaccination, like, I instantly tense up because I think this is going to hurt really bad, when in reality it doesn't. But you kind of become conditioned to, like, if you're going to hospital, you're going to get poked and prodded and this, that, and the other, or you go and have an injection and it's going to be really painful, and kind of stuff like that, and that side of things. And, I burst blood vessels in my eyes. My teeth got really bad because I couldn't brush them. And with being sick, the stomach acid was sitting on my teeth. My teeth got really bad, and stuff like that. So there's all kind of that physical side that, people see it for what it is, and sort of see that oh yeah, you're being sick all the time, that's not nice. But actually, when you really dig deeper, there is so much more, like the blood transfusions and stuff like that, being anemic, being dizzy every time I stand up and stuff like that. There is so much more when you really dig into it that kind of comes with it as well. I've kind of brought that with me, like the hyperemesis never goes away. Like in terms of my physical symptoms, have gone. They left as soon as I gave birth. But the moment I feel nauseous, the moment my toddler comes back from nursery with a sick bug or anything like that, the panic that I feel. I mean, before having kids, I never liked being sick. People don't like being sick, but it never bothered me. It was kind of part of life, I suppose. You get a sick bug, you're sick, it's fine. Now, I had a cold last week or the week before. And it was giving me heartburn, and I really struggled with heartburn in my pregnancy as well, which made the sickness worse. And I had really bad heartburn, and I woke up in the morning and I just burst out crying, rang my partner. I was like, you have to come home. I can't handle this. I can't deal with this, because in my mind, if I start being sick, I'm not going to stop. I get it in my head that if I start being sick, I've got to go to hospital. I've got to go and have fluids. I've got to go and have medical intervention. I'm not going to be able to stop on my own. And every time, when I got pregnant with my youngest, because it was so constant in my first pregnancy, every time I was sick, then it would just be panic attack. I would sit on the bathroom floor, sobbing, hyperventilating, crying. Like I just couldn't cope with the thought of being sick and having to go to hospital. And I still feel that now, even though I know logically, if I do get a sick bug or I am poorly, I'll be fine. I'll need to rest and I'll be okay. When I'm in that situation, my brain can't think logically. My brain goes straight into panic. Like, this is going to be constant. You're going to have to go to hospital. It's going to be bad. I can't cope with it. It was really bad in my first, not so much in my second, in terms of, I think because I put my foot down more. In the beginning, in the first trimester, it was really bad. I was literally in hospital every week, sometimes 2-3 times a week. It was really quite bad in the first trimester. But I had an absolutely lovely gynecologist in my pregnancy with my youngest. She came and spoke to me. I was around 6 weeks pregnant. This is my 3rd or 4th admission to hospital. And she came and spoke to me, and she was like, what medications are you on? And I said a bunch of the first line medications like cyclizine, prochlorperazine, promethazine, metoclopramide. I tried a lot. I tried an awful lot. And she said to me, have you tried ondansetron? And I was like, well, I did in my first pregnancy, and that was the only thing that worked. And she went, well, why don't I get you some ondansetron to go home with? And I was like, well, if you can. And I remember texting my partner when she went off to go and prescribe it. I texted my partner and I said, she's saying that she's going to give me ondansetron. And he was like, really? And I remember saying to him, I don't see how that's going to be possible. I don't think she's going to, I really didn't think she was going to come back with it. I really thought she was going to come back and say, sorry, I spoke to a gynecologist, or I spoke to someone, I can't give it to you yet. They don't advise prescribing it until past 12 weeks because there's risks associated with cleft lip, which, I mean, I'm not a medical professional by any means. I don't know the studies that have been done. I know that the facial features are formed at 10 weeks, so the risk decreases a lot at 10 weeks anyway, but they don't like to prescribe it until 12. And from studies that I've read, studies haven't actually shown that ondansetron causes it, but there is a correlation, which correlation doesn't always equal a cause. It doesn't always mean that that's the case, but the way I always saw, especially after what I went through before, this sounds quite morbid, and like, I put this very bluntly, but I always said to my partner, I would rather a baby with cleft lip than a dead baby, because if I carry on like this, I would rather a baby with cleft lip than no baby at all, because I can't do this without it. But yeah, she gave me ondansetron, and after that it was still, if I got poorly, sort of if I got a sick bug or a cold or anything like that, it would set off the hyperemesis. But in my pregnancy with my youngest, I don't know what changed so much. I don't know if it was because I was a little bit older, so they took me a little bit more seriously. I don't know if it was because it was my third pregnancy now with hyperemesis. I don't know if it's because I had my surgical termination before and it was on my notes and they kind of wanted to prevent that happening again. I don't know. But in my pregnancy with my youngest, I was allowed to go straight to the delivery suite to have IV fluid and stuff like that, rather than having to wait through A&E. I was given ondansetron. I was given Zenovia to try, which is a new one. I think I've pronounced that right. But Zenovia, it's just a new anti-sickness medication. And that really helped with hyperemesis. A lot of the time, it's trial and error. You need to try so many different medications to get the right concoction of meds. So I was on ondansetron and cyclizine throughout my whole pregnancy. But by the time I got to about 20 weeks, it had really settled. And I thought, maybe I've got really lucky here. Maybe I just don't have hyperemesis as bad this time around. And I was due another prescription, but my partner forgot to pick it up on his way home from work, and it was a Friday, so I wouldn't be able to get it till a Monday. And at the time, I thought, I've been fine. A couple of days without it, I'll be fine. My first missed day, hyperemesis came back with a vengeance. It was bad. I ended up back in A&E, back in hospital, back needing fluids just to kind of reset me. But I think for me, that really did go to show that the medication and actually being listened to made such a difference. Because I think, I spoke a lot about the mental side before, and obviously that is really hard. But I also think there's a lot of like the physical side that if you haven't had hyperemesis, if you haven't been through hyperemesis, a lot of people think it's just, you're just being sick. You're just, even down to the point of, in my first pregnancy, it wasn't until around 30, 35 weeks towards the end, I had a baby pushing on my bladder. I was being sick. Every time I was sick, I was wetting myself. My partner was having to clean up after me. It's not gracious. It's so dehumanizing in a sense that you've lost absolutely any kind of sense of control over what your body is doing. And then in my pregnancy with my youngest, because I'd had a baby, again, my bladder wasn't what it used to be. I'd be sick. I'd wet myself. I wouldn't go out in public because not only was I scared of being sick, I was scared of wetting myself in public. I remember I went to A&E and I'd been taken through. I was in a bay. I was sat on a bed and I was sick and I wet myself and I just burst into tears sobbing because I just felt so embarrassed and so like silly. And so I just couldn't believe that that's what my life had come to, in a way that I was in hospital being sick, wetting myself, and some poor porter had to come in and clean up after me and change the sheets. And obviously they see so much worse day in, day out. But for me, I just felt so embarrassing. So I was so young as well. I had my first, I was 17, my youngest, I was 20, and I'm sitting there and I've got no spare clothes to change into. I've got sick all over me. I'm wet. It's so embarrassing, and it's so dehumanizing, and it's so deflating. And it really takes a toll. It really takes a toll on your body. And I remember when I got pregnant with my youngest, because I was so determined after what I'd went through. I was so determined to have my baby. I was so determined to give my little girl a sibling, to have my second baby. I was so determined. I knew that I was going to do whatever it took. And in my mind at the time, the way I kind of saw it was, I will do whatever it takes to have my baby, even if it kills me. Because when you're in that moment, I remember the same time when I was in hospital and I'd wet myself on the bed and I'd been sick, and a HCA came to chat to me, and I just broke down in tears. And I remember saying to her, I don't want to die. I'm so scared I'm going to die. Because again, that physical side that I think people don't see, your whole body shuts down on you. Your whole body, you can't walk down the stairs without feeling like you're going to pass out. You can't get up in the morning and go and have a shower. My partner had to shower me. I had to sit in the bath. My partner would wash my hair, and I'd have to go to bed with wet hair. I couldn't do my makeup. I couldn't put on nice clothes. I couldn't be a person. I was a shell of myself. I was a shell of who I was. And I think unless you've been through something like hyperemesis, you don't before I got pregnant with my first, I didn't even know hyperemesis existed. I didn't even know it was a thing. I had never heard of anybody in my entire life have hyperemesis. I have no idea what it was. When I was crying to that HCA and I felt, I don't want to die. I feel like I'm going to die. I don't want to die. And you've always got in the back of your mind, people do die. There are women that die and their babies die. I think for me now, the way I see it is I don't think it's necessarily hyperemesis that kills people. I really think that it's the lack of care and it's the lack of awareness. It's the lack of understanding. It's the lack of empathy. And not that I want to kind of make it a gender issue, but for me, in my case, I always found that the female gynecologists had a lot more patience and care for me than what the male gynecologists ever did. The male gynecologists were always, the most I kind of got from them was, well, you shouldn't still be being sick right now. You shouldn't have you tried this medication? And it's like a medication that I tried about 3 months ago and it didn't do anything. And it's like, yeah, I've tried it. I've moved on. And then their point of view was always, well, you need to make sure you eat. You need to make sure. Whereas the women really, really did have a sense of empathy. I think for me, the men were always, they knew best. They didn't want to listen to my experience and how I felt. They knew best. I had a few nurses, midwives, female gynecologists, say to me, like, they don't know an awful lot about hyperemesis. They don't know an awful lot about, they haven't been through it. They don't know how it feels and stuff like that. But they were so much more willing to listen to me than what the male gynecologists ever were. And maybe for me, that was just coincidence. Maybe for me, it was just kind of the people at my hospital or what, I don't know. But I think if a lot of the gynecologists I spoke to, if they had a lot more awareness on it, and GPs as well, I think GPs too, I mean, I understand they're like general practitioners, but, I would turn up at a GP office and I would be wearing pajamas that I've worn for the past 2 weeks straight. My hair is near enough matted because I haven't had the strength to brush it, and I've not showered or brushed my teeth in days. And I'm turning up and I'm just like, please help me. And they're turning me away because they don't know enough to help me. They don't care enough, in a sense, I suppose, to help me. But yeah, I do think, I think both sides, the mental side and the physical side, both carry a lot of weight, both carry a lot of like emotion behind them and a lot of feeling behind them, and a lot of feeling that is kind of hard to get rid of after you've been through it. It never leaves you. I know my baby is only 4 months old, but even my toddler, when she kind of got to 2 years old, it'd been 2 years and it hasn't left me yet. It hasn't. That sense of being so scared and being so frightened every time I feel poorly.
Did you get any support, like mental health, like PTSD? Anyone's trying to help you and speak to you about it?
No, never. Even when I was pregnant, I don't think it was ever offered. I don't think it never, it was just like, have your baby and go home and get over it kind of thing. I never. No, I mean, my first birth with my oldest was, I don't want to say traumatic, but it was a lot to take on board. I ended up being induced because of hyperemesis. I ended up having to have a blood transfusion throughout both my pregnancies. I've had to have blood transfusions because I became severely anemic. I couldn't, they told me eat spinach. I can't even keep water down. I'm not going to be eating spinach. Do you know what I mean? But yeah, I ended up going in for a blood transfusion, and a consultant came and spoke to me. She'd looked at my notes. She'd seen how many admissions I'd had. She'd seen that I was having a blood transfusion because of the hyperemesis. And she came and spoke to me and she said, what's your plan? And I looked at her and I was like, I don't have a plan. What do you mean, what's my plan? And she was like, well, they can't be letting you go through with this. Like, they can't be letting you carry on being this poorly, being this unwell. And they're just letting you go full term and potentially get to 42 weeks and carry on being as poorly as you are. And I kind of thought, well, yeah, nobody has said anything else to me. Nobody has offered, any option. Nobody has spoken to me. Nobody, it kind of the whole way through was just crack on kind of thing. And she sat down with me and she said, absolutely not. We're not doing that. I'm going to give, I think I was about 37, 38 weeks. And she gave me a sweep then and there. And she said, I'm going to book you in for an induction on Sunday. Come in for your induction. If your sweep doesn't do anything, we'll get things moving on the Sunday. And I went in, contractions started pretty soon. Contractions started pretty early on, but they wanted to break my waters for me, and I wasn't dilated enough for about 2-3 days. So I was having contractions also while being sick and being poorly for like 2-3 days, until they finally said, yep, we'll take you to delivery suite, we'll break your waters, we'll get things going. So excited for things to finally be over. But my little girl, unfortunately, her heart rate kept dropping with the hormone drip. Her head wasn't in the right position. I had been in labour for a few days. I was exhausted. I had a few consultants come in, spoke to midwives and stuff, and they ended up calling it for an emergency C-section in the end. I just remember I couldn't stop shaking. The adrenaline, the rush of everything. And when my little girl was born, I mean, I adore her now. She's my bestest friend in the whole wide world. But at the time, I didn't feel anything for her, because the only thing I was excited about giving birth was the fact that my sickness was going to stop. I hadn't got it in my head that when I give birth, I'm going to meet my baby. I'd got it in my head that when I give birth, my sickness is going to stop. And I really struggled with that. And I never had any help offered to me for that. I never had any, I've never spoke. They never offered any kind of therapy for how my birth went. They never spoke to me. I sort of struggling to bond with her. They never,
oh my God.
I never had any help offered. I think they, from their point of view, I mean, it might not be how they saw it, but definitely how I felt was very much like, we've done our bit now. You've given birth, you've gone home. It's nothing to do with us now, kind of thing.
What actually helped you throughout your pregnancies with hyperemesis, and what advice can you give other people who are struggling with hyperemesis?
I think the only advice I can give is, do not take no for an answer. If you're going to hospitals, if you're going to the GP and you're being turned away, ask to speak to a different GP, ask for a different gynecologist, ask, there's nothing. I think for me, especially being so young when I was pregnant, I was so scared to disagree with them. Whereas in my most recent pregnancy with my youngest, don't be scared to turn around and say, respectfully, no, that's not the case, you're incorrect in saying that. Or don't take no for an answer. Don't, if you need something and you know what you need, you've been through it. Nobody, like I've said before, knows hyperemesis unless they've been through it. Nobody knows what they need more than you, like more than you in that position. Nobody can tell you otherwise, that no, you don't need that medication, or yes, you do. As long as you are making an informed decision, make whatever decision is best for you, and don't let gynecologists or midwives or whatever, just don't take no for an answer. Really put your foot down and push for it and fight for it. If it's something that you want, definitely push for it.
Amazing. You did a really great job for like pushing for what you actually want, because if you didn't, then you won't get the anti-sickness that you've got. It only takes a little, like a good gynecologist, a good healthcare professionals to actually help you and care for you.
Yeah, definitely.
Personally, I haven't been through hyperemesis, and I'm sure that a lot of people haven't been through hyperemesis. What type of things that you want to hear people say to you?
I think in the moment, I don't think there's really anything that anybody can say that's going to make it any better, unfortunately. But I think the most important thing that I wanted was just understanding. I think I just wanted people to understand me. When I was pregnant, I had a lot of, we had to let people down. We couldn't make it to family plans. We couldn't make it to events and stuff like that. And it was always, oh, that's a shame. Such and such would really like to see you, or that's a shame you can't. And I think for me in that moment, I always felt like, what about me? Why isn't it? That's a shame that Callie's in hospital again. I really hope she's okay. Or, that's a shame she's going through that. Why was it always about other people around me? Why was it always about the way I was affecting other people? Why was it never about me? And I think for me, that's all I kind of wanted was understanding and recognition that like you're going through a really hard time right now. My partner, I mean, he has been amazing throughout all of my pregnancies. And when we agreed to try for our second child, he said to me that he never would have gone through with it a first time round, let alone a second and a third. He never would have managed it. He's always said that I'm so strong for going what I went through.
Well,
And whenever I say to him, I'm really sorry that you had to do everything for 9 months, he's like, that's nothing compared to what you went through. And I think that is the biggest thing for me is just recognition. I think, if you know someone that's going through it, just understand and recognize. I think it kind of, I think for me, it kind of like takes away from what I went through and why I feel so bad about my feelings around the situation is because I think a lot of people are kind of like, oh, well, you had a bit of morning sickness, you're fine, don't worry about it. But I think if more people had that recognition for what I actually went through and that patience to understand and listen, then it would make a lot of difference. So I think, yeah, just a little bit of empathy, maybe.
you did an amazing job for like all your pregnancies. I can't even imagine like how hard it is to go through throwing up 20, 30 times a week, all the healthcare professionals telling you that, oh, just get on with it. You're really strong. You're an amazing, incredible woman. And
Thank
thank you
you.
so much for sharing your story with us. Thank you for listening to this show. If you like this show, like what we're doing here, and you want to support us, the free way to do so is to hit the subscribe button. If you're struggling and you want to share your story, please check out the link in the description. I will promise to do my best to create awareness for the conditions that people are struggling silently. Thank you and see you next time.